All right, I think we are live on Facebook now. Hello, good evening, and a very warm welcome to everyone on today's webinar on COVID-19, What We Know So Far, brought to you by the British College. Today, we have medical expert Dr. Sumitra Kafli here with us presenting on very important information regarding COVID-19 and to answer your queries. My name is Nisha Rajbandari, Assistant Program Leader for the BBA department here at the British College and the moderator for today's session. For the past couple of weeks, we have been facing an unprecedented challenge as never seen before, at least during our lifetime. The COVID-19 pandemic has affected people all across the globe. We have been forced to remain sheltered in our homes, maintain social distancing, quarantine ourselves. Businesses have been forced to close, go online. Schools are shut and classes now virtual. And most importantly, we now have a huge responsibility as individuals to be informed, stay aware, and work together in order to tackle the spread of this disease and protect individuals in our communities. The British College is closely monitoring the situation and is keen to provide as much assistance as possible to students, parents, staff, and the larger community in these trying times. As part of an effort to spread awareness and answer your concerns, today's webinar will focus on understanding COVID-19 better and healthy habits that we can instill in our daily lives to remain safe. At the end of the webinar, we will be answering your questions from our audience, and therefore please comment below on our Facebook page with your queries, and we will get back to it at the end of today's webinar session. I would also like you to know that this webinar session will be recorded and will be made available both on our Facebook and YouTube page for future reference. Now, it is my great pleasure to especially welcome and thank our medical expert, Dr. Sumitra Kafle, an intensive care and anesthetic doctor from the UK who will be delivering today's presentation. Dr. Kafle, I will be now handing over the session to you.
Hi, everyone. I hope you can see me well here. Just bear with me whilst I adjust my camera a little bit. Right, thank you so much for taking part in this webinar. I'm now going to start a presentation, a PowerPoint presentation that I've prepared, and hopefully this will give you information about COVID-19 and what we know so far. I'll obviously be happy to take questions afterwards as well. And I'm just going to share that now. Right. I hope everyone can see the presentation. I'm just getting it started. Right. So like I said, my name is Dr. Sumitra Kafle, and today we'll be presenting on what we know about COVID-19 so far. Now, in today's session, I'm going to give a brief overview of where this has all come from, what coronavirus actually means, some of the signs and symptoms, and also what the current treatment is and what the future therapeutics will be. We'll also be looking at some of the myths that's been going around. There is a lot of fake news around this, and we'll finish with some questions and answers. Right. Just a little bit about me. My name is Dr. Sumi. I am originally from Chitwan in Nepal, but I came to London when I was 11 years old. I currently work as an ICU and anaesthetic doctor in Manchester, England. I've also started a Facebook page. You can find me on Dr. Sumi on Facebook. And this was just to give people more information, mostly people of Nepal, more information about COVID-19 and other health-related issues, mostly because there is just so much fake news out there in social media, and I wanted to make sure that the information that was out there was from a reliable source. Right, so to start with, where did this all start? Now, we know that in December in Wuhan in China, there was some unusual cases of pneumonia, the cases that's never been quite seen before. This was only reported to WHO on the 31st of December 2019. And on the 7th of January, they found a new strain of coronavirus, and this is now the COVID-19 disease that's come about after that. This sort of pandemic has not really happened in our lifetime whatsoever. The last time we saw a pandemic like this was in 1918 with the Spanish flu. So this is definitely trying times and uncertain times for us all. What exactly is COVID-19 and what is coronavirus? Now, coronavirus is just a name given to a group of viruses with similar characteristics. So it's basically a family name or like a surname. There are lots of different types of coronaviruses or coronavirus that can infect humans and animals. You may have heard of MERS and SARS. These were the coronaviruses that have infected humans before. However, the current pandemic is caused by a new strain of coronavirus, and this coronavirus is called SARS-CoV-2. However, the COVID-19 is actually the name of the disease caused by this new virus. I hope that makes it clear because there are just so many different names for the same thing. Now, how does it spread? There are two main ways of spreading it. One is aerosol droplets. So these are respiratory droplets that when you sneeze, talk, or cough can go into the environment and then land on a different person's mouth or noses. When these are inhaled into the lungs, the second person can get infected. It can also be spread by fomites. What this means is if there are viruses on objects, for example, a door handle, and then someone else then goes and touches that door handle and then touches their face, the virus can get an entry into a person. This is why it's so important to wash hands, and this is why the whole message has been about washing hands for at least 20 seconds. I hope that's all okay and you can follow me so far. Right. Now, who is at risk? I'm sure you all know this, and I think it's really important to point out that anyone and everyone can get COVID-19. However, there are particular groups of people that are at higher risk of getting COVID-19. And these are elderly people, those who are above 70 years old, or those with underlying health conditions. Now, the underlying health conditions can be anything from diabetes, cardiovascular disease, such as heart attack, chronic respiratory disease, cancer, or those that are immunocompromised. Now, men in these groups seem to have a slightly higher risk of getting a severe form of the disease compared to women. In the UK, we've also seen that Black and ethnic minority communities, such as Asian communities, actually have a higher risk of dying from COVID-19 compared to white counterparts. So, symptoms is quite an important topic to cover because there are such vast majority of symptoms, and different people have get affected by the disease in different ways. Most people get mild or moderate form of the disease and do not need hospitalization. It's actually very few people that need to go to hospital. So what are these mild symptoms? So the mild symptoms, or the most common symptoms that people can get, is fever, dry cough, and tiredness. Some of the less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of smell or taste. And the loss of smell can just come on its own. Literally, you may not have any other symptoms. You may just have loss of smell as well. You can also get a rash on the skin or discoloration of fingers or toes. However, these are not common symptoms, and a lot of people are unlikely to get these symptoms. The ones that we need to be worried about are the serious symptoms. So what are they? These are difficulty in breathing or shortness of breath. Now, you get this because you can get pneumonia because of COVID-19, and this pneumonia causes difficulty in breathing because you're not able to get enough oxygen into your lungs and get that sort of passed around the body. Because of the pneumonia, you can also get chest pain, and you may have loss of speech or movement. And again, it's very important to remember that not a lot of people get this. However, if you do have this, please seek medical attention. A lot of people, like I've said again, with mild symptoms can manage their symptoms at home, and they do not need to go to the hospital. On average, it can take about 5 to 6 days from when the person catches COVID-19 to having the symptoms. However, the symptoms can show for anywhere up to 14 days. I know that was quite a complicated slide, but I do hope that makes sense, and we can come back to that later if we need to. Now, there is this global pandemic and the whole world is in lockdown, but how serious is COVID-19? Now, the initial data show that number of people that get severe illness is around 20 to 30%. And the number of people that actually, the number of people that need hospital is 20 to 30%, but the number of people that, or the percentage of people that have severe illness is actually only around 4%. And even in this, the mortality rate is between 1 to 3%. But the problem is, because this is a new infection, none of us have immunity to it. So 1 to 3% of infected people, and potentially everyone could be infected, is actually quite high in terms of numbers. Influenza also has a 1% mortality rate, but with influenza there are vaccinations, and obviously some of us may already have immunity to it because it affects different parts of the countries in slightly different times, and hence in terms of actual number of people that die might be less. Okay, and again, it's very important to reiterate the fact that a lot of people who need to go to hospital are those who are above a certain age or those who have underlying health conditions. Now, what do we do if we have COVID-19? So if you have COVID-19 at home, what should you be doing? Okay, the most important thing is stay at home. Stay at home unless obviously if you have the severe symptoms and you need to go to the hospital. And try and isolate yourself from the rest of the family members if you are at home. So the way in which you can do that is, if you can, use a separate toilet or a bathroom, confine yourself to one room if possible. And if this is not possible, then make sure the bathroom is cleaned after you've been to it, and all the shared room or shared spaces are cleaned afterwards. Obviously, look after yourself, get plenty of rest, get hydrated, and take paracetamol, especially if you've got aches and pains and if you have fever. If you do have to sneeze, please try and sneeze into a tissue and discard it immediately, or sneeze into your elbow, sort of like this. And wash your hands as often as you can, and do so for at least 20 seconds, because again, we can have viruses in our hands, and this means we can get rid of the virus, and we're not then touching other surfaces and transmitting this virus. And for breastfeeding mothers, please don't stop to breastfeed. You can wear a mask, just a cloth mask, whilst you're breastfeeding, and don't directly sneeze into the baby. And before handling the baby, just wash your hands. And obviously after handling the baby, also wash your hands. It's quite important that mothers still breastfeed, because the milk might potentially have the antibodies that will be beneficial for the child. So those are the things that you can do to keep yourself and your family safe whilst you have COVID-19. Now, in terms of self-isolating, we say self-isolate, but there seems to be confusion about how long to isolate yourself for. So I'm going to go over this quite slowly so that everyone understands this, because it can be a little bit complicated. So if you have symptoms, so this is if you have symptoms, not if your family members have symptoms. If you have symptoms, please isolate yourself for 7 days from the onset of the symptoms. After 7 days, you can stop self-isolation if you don't have a high temperature. However, if you do have a high temperature, please continue to self-isolate until your temperature returns to normal. And a cough can last for weeks after the infection. So if the only thing you have after 7 days is a cough, you can stop to self-isolate. However, the rules are different if one of your family members has COVID-19. So what do you do if it's one of your family members? If you live with someone who has the symptoms, self-isolate for 14 days from the day their symptoms started. So this is, again, because you can get symptoms anywhere from 1 to 14 days from when you catch the infection. So it's quite important, those 14 days. However, if more than one person at home has symptoms, self-isolate for 14 days from the start of the first person who got the symptoms. In those 14 days, if you, however, start to get symptoms, you need to self-isolate for 7 days from the start of your symptoms. And even if this is longer than 14 days, you would still have to do it for longer than 14 days. I hope that's clear. Now, this I've been asked this question quite a lot. What precautions can we take when we go out, if we do have to go out, for example, for food shopping? Now, if you are one of the at-risk group or an elderly person, please avoid going out. Get someone else to do your shopping. And if you do have to go out, very strict hygiene measures, hand hygiene measures, for example, again, washing hands with soap and water. And if you can't do that, use a 70% alcohol-based sanitizer. And if you are out and about, try and avoid touching your eyes, mouth, and nose, because this is the route that the virus can take to go inside your body. Keep at least 2 meters distance from others when you're out. And if you do need to go out, and if you're handling shopping trolleys or basket, use sanitizer to clean them first and then handle them. And once you're home, again, wash your hands thoroughly for 20 seconds. And also after you've handled the groceries and stored them, wash your hands again. There is currently absolutely no confirmed cases of transmission of COVID-19 from food or from food packaging. So this is good news for us. But at the same time, we know that virus can stay on some products for a certain amount of time. So it's always good to be cautious. Right. Now I'm going to move on to treatment. So hopefully a lot of people won't need this, and we know that a lot of people won't need to go into hospital. And so the 20 to 30% of the people that do need to go into hospital, all they will need is oxygen and perhaps paracetamol if their fever is high. So this is just a supportive treatment in the ward. And they may also benefit from lying in a prone position. What this means is lying in their front. However, if anyone does have to go to intensive care unit, there are other things that we can do in intensive care unit. Now, it's important to know that there is no cure for COVID-19 so far. So anything that we do in intensive care is just a supportive treatment. What this means is we're supporting different organs so that body has time to recover on its own. The immune system will then try to make its own antibodies, and hopefully in time, which could be 2, 3, or 4 weeks, it will be able to recover on its own. In all of this time, all we're trying to do as medical professionals is support your body. Okay, so some of the things that we do in intensive care, again, prone positioning. Now, why do we do prone positioning? The answer is quite complicated. It's to do with something called VQ mismatching. What that basically means is that if you try and use another part of the lung that you're not using yet, hopefully that part of the lung has better opening so that oxygen can go into that lung, and there's also better blood supply into that lung so that that oxygen can then be taken to the rest of the body. So that's essentially the reason for prone positioning. It's to do with VQ mismatching. If you want to look that up later, you can do. And obviously the other things that we do is organ support. So looking at the different organs for respiratory, and this seems to be the one that needs the most support, what we do is intubation and ventilation. So what does intubation and ventilation mean? It's when you put a tube through the mouth or through the nose, and this tube goes and sits in your lungs, or to be exact, it sits in your trachea. What that does then is that can be attached to a ventilator, and a ventilator is a machine that can do the breathing for you. Okay, so that way we're supporting the respiratory system even. And then there's a cardiovascular system, such as your heart and your blood pressure. And again, these can fail when you have the infection, if you have a severe infection. And the way in which we try and support this is by giving medications such as, you may have heard of adrenaline and noradrenaline. These are some of the medications that we can give to try and make sure they work in the best possible way they can. The renal system can fail as well. So this is called kidney failure. And if it does, again, it will be for an acute period of time, and in this time, what we can do is dialyze the patients in ICU. Now, with some COVID-19 patients, especially the ones that go into ICU, we've seen that they make more clot. There is more clot formation. What these clots can do is go into different organs and cause further damage. For example, it can go into the lungs and cause even more damage. Apart from the pneumonia itself, it can go into kidneys and cause kidney failure. So in ICU in the UK, we give something called low molecular weight heparin at a higher dose. What this does is thins your blood essentially, and by thinning your blood, it reduces these formation of clots. Now, it's very important to know that low molecular heparin is only given in hospital, and you need to have blood test in the hospital for this low molecular weight heparin. Please don't take it in the community, because if you do, there is a risk of bleeding, and bleeding can then lead to death. So this is only for patients who are in hospital. Now, sometimes when you've got COVID-19, and especially if you've got a severe form of the disease, you can get other infections, which are bacterial infections on top of the viral infection. And if we think you have this bacterial infection, we then give antibiotics, because we know that antibiotics do not work on viruses, they only work on bacteria. So there is no point in taking antibiotics for COVID-19. We only give it if we think there might be another infection on top. So please don't go out and start buying antibiotics and taking antibiotics. This is not going to help. If anything, this will cause other problems such as resistance. Right. So there is no cure, like I've already said, but what can we do whilst in the meantime we try and wait for the vaccination or for the cure? So these are the things that we're doing already, such as social distancing, isolating when you're unwell, and hand hygiene, and obviously a global lockdown. So lockdown in many parts of the world at the moment. So the aim of all of this is basically to reduce the virus reproduction rate. So this is known as R0. Now, during the peak of the disease, the R0 for coronavirus, or this COVID-19, was thought to be around 3. What this means is that if one person is infected, they can then go on to infect 3 other people. And those 3 other people can then go on to infect 3 other people individually. So this sort of growth is known as exponential growth. And there is a graph here to show that exponential growth. It basically, the virus basically reproduces at a very, very high rate. Now, the only way to reduce that is by doing lockdown and social distancing. So the aim is to get this R0 number to less than 1. What this means is that if one person gets the virus, the chances of that person passing the virus to another person is less than 1. And I don't know if you've seen a graph like this, where everyone talks about flattening the curve. So this is the curve that we're trying to flatten. So if you can see here, the numbers, if these numbers are allowed to go up, the graph would go something like this. However, by doing lockdown, we're trying to flatten this as much as possible so that there is no exponential growth, or this virus doesn't reproduce in the same way it has the ability to. Now, looking at what we can hope for the future. Obviously, there are lots of different trials and lots of different treatment modalities that we're looking at around the world. One of them is called a recovery trial. So this is a trial that was started by WHO. It's a randomized controlled trial looking at different treatment options. What this means is that if one of these treatment options shows positive results, if patients who've taken one of these treatments show that they've improved dramatically, we can then in the future use that treatment, and that may be the cure for it. But so far, we don't have the results for them. The other one that you may have heard of is called the convalescent plasma therapy trial. Now, again, this is just a trial at the moment. This is not a treatment. Not everyone gets it. It is still being trialed to see if this helps. The idea behind this is taking plasma from people who've already had the disease and recovered, and giving it to people who currently have a severe form of the disease. Plasma is the liquid part of the blood, and plasma has a lot of antibodies. So if you've recovered from the disease, you're likely to have antibodies that will be beneficial to someone else. So the hope is that by giving that antibody to a person who has a severe infection, those antibodies will work in that person and reduce the severity of the disease, or help the patient to be cured, essentially. Again, this is just on a trial basis at the moment. This is not known as a cure as of yet. And obviously around the world, everyone is working on a vaccination. The team at Oxford is they're probably the ones that have had most success. They've already started a human trial. Now, at the moment, the virus is very stable. It hasn't had any genetic mutation yet, which is a very good news for trying to develop a vaccine. Although the timeline says that we are likely to see this vaccine ready and working by September, it's very important to know that just if there is a vaccine by September, everyone is not going to get it in September. It's going to take a lot longer for everyone around the world to actually start getting this vaccine. However, there is still a lot of hope. But in the meantime, all we can do is what we're doing now, isolating ourselves and looking after ourselves. The next few slides, I want to go over all the fake news and a lot of myths that's around this virus, and there are so many, so I've just chosen a few that I find particularly interesting. So one of them is eating garlic or lemon can cure you or prevent you from coronavirus. Whilst they're both very healthy food, there is absolutely no evidence that this is going to prevent you from getting coronavirus. Similarly, gargling with salt water and saline will help you prevent from getting coronavirus. Again, this might soothe your throat, but it is not going to prevent you from getting the virus itself. The virus will go inside whether you're gargling with salt water or not. Similarly, by drinking a lot of water, you can flush out the virus. Whilst drinking water is very good, if you drink a lot of water and if you're drinking sort of 10 liters of water, you're going to get other problems with this. So please don't do so. Don't drink that much water. This is definitely not going to flush your virus from the body. None of this is going to help. There seems to be a lot of myths around hot weather, hot water, hot bath, anything to do with hot kills the virus. Now, initially, I can understand why people thought that, because initially in laboratory tests, we found that the virus wasn't able to spread as much when the temperature was higher. However, this virus had spread in all areas, in all different countries with different temperatures and different humidity level. So just because there's of a hot day or by sunbathing, you're not going to reduce the risk of catching the virus. Also, drinking warm water also does not kill the virus. And in fact, if you're drinking very hot water, you're likely to burn your throat. So please don't do it. Another common one seems to be taking a hot bath can prevent you from catching it. Now, if you do take a hot bath and if the bath is very hot, you're likely to burn your skin and cause more damage to the skin and get infection on top of that. Your body has to be kept in a certain temperature, and your body will try your best to make sure that the temperature inside your body does not change, no matter how hot bath you take. So this is just going to cause you harm and it's not going to help you. So please don't do it. So these are probably some of the most dangerous myths that are around. Spraying yourself with bleach or another disinfectant all over your body can kill the virus. Now, whilst using bleach and other disinfectant in surfaces, so what I mean by that is, for example, door handle, can kill the virus, these products are not for the body. If you spray these products onto the body, it will irritate your skin. It will also irritate your eyes. These chlorine-based products can go into your lungs and cause cause bronchospasm. Now, bronchospasm is when you can't breathe. And this is very, very harmful. So please don't spray these bleach products. It is not going to help you. Another one that's quite popular seems to be drinking ethanol, methanol, or bleach can kill the virus. Again, this is only going to damage your internal organs. The way the virus gets inside your body is not via a stomach. So this is not going to kill the virus and this is not going to prevent you from catching it. Please do share these myths to everyone, all your friends and family, because these are all very dangerous. And the more information there is about this, the better, because I've seen some footage from Kathmandu of people who have been sprayed with bleach, and this is very, very harmful, especially to children. It just should not be done. Now, I'm going to sort of conclude this by looking over stress and anxiety. I know that during this global pandemic, there is a lot of anxiety and stress, and our emotions can be up and down. First of all, if you are feeling like this, you are not the only one. Everyone can feel like this at different times in their lives. And we don't talk about mental health in Nepal or Nepali community. It's seen as a taboo. But as young people, especially of young people from the colleges, I hope that you can be the ones to change this and talk about mental health more. So these are just some of the quick tips to help you during this time, but hopefully in the future as well. Just give me a second. I just need to open. No. Absolutely fine. Right, we're going back onto this now. So what can you do? Very quickly, please have a routine. I know none of us are going to work or to college, so it's very easy to sleep until 12 or 1 o'clock. However, if you have a routine, go to bed on time, wake up on time, get up in the morning, have a shower, eat on time. All of these can help us sort of have some sort of formality in our day and help us through the day. Obviously, keep informed with news, but make sure any news that you're getting is from a reliable source, for example, WHO, or even news channels that you find actually portray reliable news and not just fake news. And if you're finding that actually by looking at news all day, every day, you're becoming more anxious, then just stop it. You don't have to look at news every single day. And if you do think you want to know what's going on, just do it once a day, either in the evening or in the morning, and that's it. And I know it's very easy to stay at home with iPads and phones and laptops, but try and limit the screen time as much as possible. If you find that you're on your laptop all the time or on your iPad all the time, just take a break, go outside for a second, come back. And a lot of us use social media now, and although there is a lot of fake news around in social media, we can also use it in a positive way. So please use it to promote positive and helpful stories. And if you do see misinformation, try and correct it if you can. And we all know that we're social creatures. We need to be in touch with other people. And by doing sessions like these, we can be, I know it's virtual, but actually it makes us feel like we're still part of a community, part of a team. And helping others is probably one of the things that makes a lot of people content with their lives. So if you have a neighbor who's elderly and cannot do the shopping, do that shopping for them. It will help you feel better about yourself as well. And again, I know that a lot of us can't go to the gym at the moment because they're all closed, but there are lots of YouTube videos on keeping healthy, or just a 15 minutes, what we call HIIT exercises. Do them, challenge yourself. It means it gives you a purpose to your day. And similarly, whilst keeping physically active is important, being mentally active is also as important. So you can do things like board games. I know when I was in Nepal, I used to play snakes and ladders a lot. I'm sure the board games have now evolved. Why don't you play that with the whole family? It just means that you are focusing on something other than the pandemic and actually spending time with your family and doing something that you wouldn't be able to do if there wasn't such a pandemic. So look at it in a positive way. Or similarly, learn new skills. Get your mum to teach you how to knit, for example, if you can. And the last but not the least, and the one that I couldn't recommend enough, is mindfulness. Now, what is mindfulness for people who haven't come across it before? Mindfulness is the basic human ability to be able to be fully present and be aware of what's going on around us. Okay. It's very simple to do, however, it can take some practice, and you don't have to do it for half an hour or an hour. Just start by doing it for 5 minutes. Just go onto Google Podcasts and type in mindfulness, and you'll be able to get lots of podcasts on it. And I really couldn't recommend it enough. It does help you. And we recommend it a lot in the NHS as well. So hopefully you can use those tips, not just now, but for future as well. If you're ever feeling like you just can't handle it, the stress is getting to you, either it's due to exams or something else, and hopefully some of those tips will be helpful in the future as well. Now, to finish with, of course, in parts of the world, we're now starting to reduce lockdown, but what can we do to try and make sure we're still keeping safe? So it's the same measures that we're doing now. Again, try and avoid large crowds or gathering, wash hands regularly. If you do have symptoms, isolate yourself. And I know that using masks is very controversial. However, if you do have symptoms, it's a good idea to use mask. But if you are using mask, please don't use the medical mask, such as FFP3, FFP2, because using these masks means that there is already a shortage, and there's going to be more of a shortage for healthcare professionals who really do need and use them. You can make masks yourself. But again, another important thing to remember is if you are using mask, you can't then relax your isolation or relax your sort of other hand washing measures, because that mask itself can have a virus. So if you're touching your mask and then touching your eyes, you can still get transmission. So mask is not the answer. It may help, but it's not going to be an answer. And you still need to do all the other things that you would do to keep yourself safe. Thank you so much for listening to me. You'll be able to ask some questions now, which hopefully I'll be able to answer. And if you found this useful, please follow me on Dr. Sumi on Facebook. I've created this page just to, again, bust some of those myths and fake news that are going around. I'll be able to post more health-related videos there as well. Thank you so much. Right, I'm going to stop the presentation now. Right, I think I'm going to go back.
Yes, thank you for your presentation, Dr. Kafle. We will now be moving on to Q&A session. We have received quite a lot of questions beforehand from students and staff who have had a lot of questions regarding COVID-19. The presentation has covered a lot of the questions, and it was very informative. And we will now proceed to some other questions that we've been receiving. So I will get back to the question. All right, so the first question is regarding vulnerable individuals. I know in your presentation you covered about precautions these people have to take, high-risk individuals when going out. But what if we have a family member who falls under that high-risk category, right? What can other family members do, extra precautions that they can take to protect these individuals?
Thank you for that question, quite an important one. So if you live with a person who is in a high-risk group, again, it's trying to minimize contact with them. So if you're living in the same house, try and keep that 2 meters distance if you can. If they can just use a separate bathroom, let them use that bathroom, and other people shouldn't go and be using that bathroom. And obviously, if you can't, there are other measures like I talked about in my presentation, cleaning after you've used those. But also, don't let them go out. And if you are living with them, if you can stop going out, or if you can reduce the amount of time you go out, that would also be very helpful. And then it's just simple measures like washing hands. If you are touching lots of surfaces, common surfaces, and the vulnerable person also touches those surfaces, just make sure you clean after yourself. So again, it's trying to isolate as much as possible, really, and there isn't really anything else that we can do.
All right. I think, continuing with people from high-risk category, we have a question here. Are pregnant women more vulnerable to the coronavirus? And if they are, what precautionary measures they have to take during their pregnancy?
Right. So we know that with other diseases like influenza, pregnant women are in slightly higher risk, or when pregnant women do get it, we worry that the unborn child, or they might be at risk. So with coronavirus, that's why we've said, if you are pregnant, try and look at yourself as one of the at-risk group, and try and isolate yourself as much as possible. Although there hasn't been many cases, there's been 1 or 2 now of pregnant women who have had severe disease and died from it. There haven't been that many cases, and actually the newborns that have had coronaviruses have also been completely healthy. So don't be too scared about it, but consider yourself to be at risk group and try and isolate yourself as much as possible. But know that even if you do get it, you and your child are most likely to be fine. Does that answer the question?
Yes, I think that has covered most of it. Again, continuing with precautions and safety measures, we are slowly starting to see that businesses have started delivering essential goods. So whether it's grocery or other essential items, we're also seeing that restaurants in Kathmandu, for example, have also started doing takeouts. So how safe is this, and what additional precautions these businesses as well as people who are using these services, what can they do?
So in terms of what the businesses can do, try and minimize the people that are coming to work. So rather than having 10 people that are working in a restaurant, just have 1 or 2 people. And again, if you can, within the business, try and isolate them or try and keep that 2 meters distance as much as possible. So if it means, one person does the vegetables, leave that person to just do the vegetables, and then someone else does something else. Try and really minimize that contact. Now, in terms of, like I said earlier, there haven't been any cases of people getting coronavirus from food or from food packages. However, we've seen that virus can, especially in packages, virus can live in the packages for about 24 hours in some of the packages. Now, I wouldn't say do not get a takeout. I think it's fine to get a takeout because we still haven't seen any cases. We don't think by getting a takeout and eating this food, you're going to get coronavirus. But what I would say is if you can avoid trying to take out too many takeouts, or if you can avoid sort of touching hands of the people when you're getting that delivery and minimize going outside, do so. And like I said earlier, I know the viruses can potentially last in, say, for example, a cardboard packaging for about 24 hours. The actual, how much of the virus or the live virus stays on that cardboard is not yet known. And we think that the actual live virus doesn't stay in the cardboard for as long as 24 hours. It's just that when we've done a swab, we've seen some fragments of or the DNA of the virus in the cardboard packaging. So it doesn't mean that, but just by touching it 24 hours later, you're going to get the same exposure as you would when you're standing in front of the patient or front of a person who's infected and they sneeze. Does that answer the question?
Yes, I think we've covered both about in terms of contact with the delivery personnel as well as packaging. I think I'll move on to another category of questions here. And related to immune system, right? So there's been a lot of talk about boosting the immune system, and so from your point of view as a doctor, does boosting one's immune system, does that really help us fight COVID? Is it more about fighting COVID when you get an infection, or is it more about preventing us from getting the infection itself if we have a healthy immune system? There's also been a lot of debate regarding this because there have been some cases reported about people getting reinfected. So what does that mean? So if people get reinfected, does it mean that you cannot develop antibodies for it? And so developing an immune system does not make sense. So there's been a lot of confusion regarding this. So it'd be great if you could clarify about immune system here.
Right, so your first question was about trying to boost immune system and whether this is helpful. Is that right?
Yes. So yes, because there's been a lot of information about that people are trying to change their habits, eating habits, try to beat the immune system, try to beat the virus through a healthy immune system. So how much does that help?
Okay. Right, so boosting immune system, it's very difficult to answer this question because there's a lot of gray area around this. Of course, if you are someone who can reduce stress, if you can eat healthy, if you can lower your weight, if you can stop smoking, like these are all things that will help you become a healthier person. And if you are a healthier person, then the chances of you getting severe illness is likely to be low. So in some aspects, yes, it will help. However, you know, just by now having lots of multivitamins, or just by, you know, starting to drink a lot of water, doesn't mean that you won't catch the virus. All it means is that adopting a healthy lifestyle will generally help us from you know, catching infection, not just COVID-19. It generally will help us from catching infection. But whether by now starting to take all these healthy measures, whether it will completely stop you from getting the disease, we don't really know, and we don't think it will. But there's obviously evidence that if you do have a healthy immune system, by that what we mean is if you're healthy, if you don't stress as much, if you eat the right food, it helps your physical health. And if your physical health is good, if you don't have cardiovascular disease, or if you're not completely obese, the chances of you getting a severe disease will be lower. So that's what I'll say about that. And the second question was to do with whether the immune system and whether you can get the disease again. Is that correct? Yeah.
Yes.
Okay. So that's actually a very interesting question. So we don't know a lot about this strain of coronavirus because it's only been around for about 4 or 5 months now. Now, with other coronaviruses, for example, SARS and MERS, once you have the infection, you have those antibodies for about 2 years afterwards. Now, with this strain, we don't know how long you can have those antibodies for. It might be just for a couple of months, or it might be for 2 years, just like MERS and SARS. And hence, because we don't know how long we're going to have these antibodies for, we really can't tell whether you're likely to get the infection again. So if it only lasts for a couple of months, then yes, you will get the infection again. But how severe that second infection will be, we don't yet know. We think that if you've had an infection before, and especially if you've had a severe infection before, the amount of immune response that you create in that first episode is likely to be higher. So the concentration of antibodies are likely to be higher. So if you do get a second infection, you're unlikely to get that same severe reaction because there will be some sort of memory within your immune system. But again, how long will that last? We really just don't know. So this is something that hopefully in a year or two, we'll be able to tell you for certain.
All right. Thank you, Doctor. We will now talk more about, situation in Nepal here. So, slowly we've seen that the number of infections are slowly rising. Where do you think Nepal is in terms of stage of transmission? So we've seen a lot of countries who have reached the peak, and then now they're slowing, the infections are slowing down. Where do you see, in your opinion, where do you think Nepal stands currently?
So in Nepal's cases, I've been quite confused in the way in which you're starting to see infections. So in most other countries, what's happened is you're getting a couple of infections, and then what's happened is very quickly, because of the fact that R0 was about 3, you're getting that exponential rise, that quick peak. And then what people have done is try to do lockdown when that started to rise. And by doing the lockdown, then you're sort of seeing that flattening of the curve. But in Nepal's case, they started doing lockdown very early on when they only had few cases. So by now, I would have thought, for example, places like New Zealand, when they have successfully stopped their lockdown, they currently have no cases. And I would have thought that if Nepal had done lockdown properly, and if people who had the symptoms were all tested, and if there were no transmission, if the R0 was sort of close to 1 or less than 1, by now I would have thought the infections would have been a lot less, and we would have seen sort of similar case to New Zealand. But actually, we're not seeing that in Nepal. So I don't really know whether this is because not everyone who has the symptoms are getting tested, or perhaps people, perhaps the borders aren't actually properly closed and people are able to come across from India or other countries and then bringing this new infection in. I really don't know. It's really difficult to evaluate whereabouts it is on that curve for Nepal, to be honest.
And also, when we look at the people who have, in Nepal being infected, we see that a lot of them have recovered, or they're only getting, as far as the information that has been given has been made public, that it has been mild cases. Any thoughts on why we are seeing mild cases here?
Right. A lot of people have asked me this on my Facebook page as well, and I think the general consensus amongst Nepali people seems to be that they somehow have a better immune system, or perhaps their immune system is slightly better and hence they're not getting the severe form of the disease. And I don't think that is the case. We haven't seen a population that has a completely different immune system and unlikely to get the disease. And there have been lots of Nepali people in the UK and across the world that do get COVID-19 and that have died from COVID-19 as well. So I don't think we are these special groups of people at all. Now, the only thing I'll say for that is, because your infection, the number of people that are infected are so low, and we know that a lot of people don't get a severe form of the disease. It's actually only about 3 or 4%. So if you're not getting a huge number of infection, then that percentage of people with severe illness is going to be low. So that's one. And secondly, I don't know if people, say, for example, people who are in the villages, people perhaps who've died, are they necessarily going and getting tested for the infection? Or if they have died, are authorities then going and testing them or asking questions about whether they were likely to have coronavirus? And until and unless you've done all of that, how are you actually going to know if anyone has died from it, or if people did have severe infection? If you're not accounting for all of your population, then you're just not going to get that information.
Mm-hmm. Yes. I think we have some more questions coming in from our Facebook here, and most of these questions I can see are regarding the various myths, or myths versus facts questions over here. I think the first we have a question here about blood groups. Does it have any relation to how prone we are to catching COVID?
So I have read about this a little bit. I think there was some suggestion that certain blood groups they were seeing that was at slightly higher risk of getting a severe form of disease. But actually, when you look at, again, the data is very small. And when you look at the data, as of now, we haven't said that certain blood groups do not get severe form of the disease and other blood groups do. We cannot say this for certain. I know there were some sort of cases where they found that actually one type of blood group were getting a severe disease, but now looking at the data, it has evolved and we don't think that is the case. But again, I think it's always important to highlight that we don't know about this disease very well. We've only known about it for 5 months. So in 2 years' time, what we know will be very different to what we know now. So what's this space? Maybe there is something to it, but at the moment, we don't think there is.
Another question, again, related to myths versus facts here. Vegetarians, are they less likely to get COVID than non-vegetarians here?
Again, no, absolutely not. There is no science that has proven that vegetarians are less likely to get COVID-19. You don't get COVID-19 by eating meat. And I know that initially there were questions about how this COVID-19 actually came about. And we know that bats are natural hosts of coronaviruses, and there may have been sort of transmission from sort of bats to and eating of the bats for initial phase, although that's not been confirmed. But by being vegetarian now, you're not less likely to get the infection. However, what I will say is that, treating animal well and having a sort of good welfare of animals and thinking about how much meat we're eating and where this source of meat is coming from is quite important. Just on a global level, this has so much impact on, the climate and just showing some humanity towards the meat industry. I think it's quite important to look at sort of the amount of meat that we're eating and try to reduce that as much as possible. That will help the world as a whole, but not right now to prevent yourself from corona.
All right. Thank you for clarifying, those myths versus facts. And as we move on to some final questions here, because we have a lot of students watching, parents watching, from your perspective, when do you think realistically we can, expect for, schools and colleges to go back to normal and have face-to-face delivery of classes?
I think that really depends on the country. So it depends on your numbers as a whole. So places like New Zealand, to be fair, they can probably start doing that soon. Whereas for us in the UK, we're probably a few weeks behind them. And for Nepal, again, you really have to look at what happens once the lockdown is sort of reduced a little bit, and then make plans as to whether you can open schools. And if you are opening schools, how do you do that? Do you just have certain classes and certain people for, you know, the first half of the week, again, to try and minimize contact as much as possible? Or do you deliver some classes online and other classes in the college? It's a plan that every country, I think every school has to make individually. It's not something that I can advise for the whole world, really. It depends on your numbers.
All right. One final question, as we have now reached the end of today's session. I think, you know, there's so much of misinformation going around in the web, as you mentioned, and, you know, we've talked about a lot of myths and facts. What is one thing that one important, if you had one point to make today, what is it that you would like to convey?
Thank you for that question. I think what I would like to say is, I know it is a global pandemic and I know it's uncertain times, but the amount of people who get the virus and recover, it's sort of over 98%. So please don't think that by getting COVID-19, you're going to die. The chance of that happening is very, very, very low. And also, please don't think of this as a disease of people that, you know, don't look after themselves, or a disease because, you know, you've been punished by God or something like that. It's not your fault if you get the disease. Everyone and anyone can get the disease. Try and treat people with the disease with the equal amount of respect that you would treat to people who don't have the disease. I know I've heard and read on papers that, you know, people who have COVID-19 aren't coming forward, and people who have the symptoms in Nepal aren't coming forward because they're scared of the consequences of that. And I really don't understand this, because it's not your fault. Like, if you've had the disease, it's no one's fault. It's just the way it is. So rather than fighting each other, we should be fighting the disease. So please don't have this misconception that, you know, people who get it are somehow inferior than you. They're not. Thank you.
Thank you, Dr. Kafle. With that, I think we have now reached the end of today's session. I would like to thank everyone who has joined us live in today's session and, you know, have been sending us questions. Please note that this webinar is being recorded and will be available in our Facebook page as well as in our YouTube page. And if you found all the information that we've given today useful, please do share it. Also, a very special thanks to Dr. Sumitra Kafle over here for giving us your time. I can only imagine the pressure that medical professionals are facing at this moment. So we really appreciate you to separating and having this, providing this valuable information with us today. So thank you so much.
No, thank you so much for having me.
Thank you, everyone. That is officially the end of today's session. Thank you. Stay safe, stay healthy, and let's work together to stop the spread. Goodbye, and have a good evening.